So continuous glucose monitors, love them, hate them. They're now available, so people even without diabetes are wearing them, which I think is great because you get to know the fluctuations of blood sugar during the day. I think sometimes having all that knowledge, though, can be detrimental because blood sugar swings are normal. And if you don't know about that and you happen to see a low blood sugar of 40, that can cause a panic in someone. And I'm talking about people without diabetes now. Women, we can go down to 40 and it's considered normal. But I'm just going to give you the average. Blood sugars before we eat, so first thing in the morning, should be anywhere from 80 to 99. An hour after we eat, they should be less than 140. 2 hours after we eat, they should be less than 120. So if you ever have a blood sugar that is greater than 140, I would have your doctor evaluate it and check further labs such as a hemoglobin A1C just to make sure that you don't have glucose intolerance or diabetes. However, a person asked, I have a blood sugar of 100 after eating, and that's within the normal range. And then 2 hours later, it went up to 110 to 115. And again, that is within the normal range. But why did the blood sugar go up? Well, there's a few reasons. One, did you have a high protein meal? Did you eat all meat, cheese, and no carbohydrates? What happens when you eat high protein, even if there are some carbs in there, it slows the absorption of carbohydrates into your body, so your blood sugar will rise slower. Were you more inactive after eating that meal? Think about Thanksgiving when we all sit around and we eat a lot, and usually it is higher protein because it's turkey. And then if you're not moving, again, the stomach is not absorbing the food as quickly as it would if you were exercising and moving around. So there's a lot of different factors that go into blood sugar variation. And I would say if you're concerned, yes, reach out to your provider, but I would ask you to do some research first and just look at normal blood sugar variation during the day. Believe it or not, exercise throws off our blood sugars where we can spike after exercise versus most people would think we would go down. And most people do, but there are a few of us that will spike after exercise. Blood sugar variation is fascinating. Take a look at it.